Hello, and welcome to the ISTH World Thrombosis Day Ask the Expert series. Today, we will be discussing the basics of thrombosis to help provide a better understanding of the condition. I'm your host, Dr. Geoffrey Barnes. I'm a cardiologist and vascular medicine specialist at the University of Michigan in the United States. My work focuses on anticoagulation care, particularly for patients who have had a venous thromboembolism or atrial fibrillation. I'm extremely pleased to be joined today by Professor Beverley Hunt, chair of the ISTH World Thrombosis Day Steering Committee and a professor of thrombosis and hemostasis at King's College London, as well as a consultant at Guy's and St. Thomas's Hospital in the UK. Professor Hunt, it's really a pleasure to have us with you today.
It's really lovely to be here with you, Jeff. Thank you for having me.
Well, let's go ahead and get started. Let's begin with the basics. Professor Hunt, can you briefly explain to us what thrombosis is and how it forms in the body?
So when we think about the blood, we have to remember its main purpose is to flow through the body and supply all of the organs with oxygen and nutrition. And it's really important that it flows. But if there's a breach in one of the blood vessels, so you cut yourself and you cut through a blood vessel, it's really important then that we block off the hole so that the blood doesn't flow out of the body and we exsanguinate. So that process is called clotting. And in order to stop the hole, we need to form a clot. And a clot's made up of two constituents, really, some little things called platelets, and also the clotting factors work together to make something called fibrin. So that's really what a clot is. And what we're going to be talking about next is some of the situations where clotting can go wrong. I should say that technically a clot can happen anywhere, but a thrombus, which is the medical term we tend to use, a thrombus is a clot within a blood vessel.
So it sounds like sometimes clotting is a really good thing. Like you explained, if you cut yourself, you want to clot so you don't bleed out. But I also understand that sometimes clotting is a bad thing. It happens when it's not supposed to. And I'm wondering if you could help us understand a little bit about the different types of bad clots or clots that really aren't supposed to happen.
Okay. So when we think about what causes people to die across the world, and the World Health Organization look at that every couple of years, we know that 1 in 4 people die because of clots being in the wrong place. That's 1 in 4. It's an amazing number to think about. And when we get clots in the wrong place, for example, if we get clots in the blood vessels that supply the heart, the coronary arteries, that's known as a heart attack. That's the commonest cause of death due to clots. The second is if you have a clot in one of the blood vessels that supplies the brain, and then you would lose a bit of brain. That is known as stroke. And then the third one, which is less well known, but really important, and I think more of the focus of what we want to talk about today, are clots in veins. Now, veins bring blood back to the heart, and the commonest form of a clot in a vein is a deep vein thrombosis, which is a clot in the deep veins of the legs. And they can cause back pressure, so you get the swollen legs, swollen foot, and they can also break off and travel through the body, through the heart, and actually block the blood supply to the lungs. And that is known as a pulmonary embolism. So those are so much less known and so important that people do understand that those clots exist.
You know, it's interesting. You talk about the clots in the arteries, the heart attacks, and the strokes. And I think most people are aware of those, but it's those clots in the veins, the deep vein thrombosis or the pulmonary embolism, that are really quite common, but many people aren't aware of. I'm wondering if you could help us understand, when we think about the deep vein thrombosis or the pulmonary embolism, What are the top maybe 3 or 4 risk factors that people need to be aware of so that they know whether or not they might be at risk for developing one of those vein type of clots?
Okay, so you're absolutely right. Deep vein thrombosis and pulmonary embolia are common, and we know that 1 in 1,000 adults will have one every year. When we do the breakdown of the causes of the clots, the number one cause, and it always surprises everybody, it's not traveling, it's not getting on an aeroplane, because people are very aware of travelers' thrombosis. It's actually being admitted to hospital. So people who are sick and admitted to hospital, they have lots of risk factors for clots. Years ago, in 1846 in Europe, a German pathologist called Workhouse described the 3 main risk factors for clots, and they are changes to the blood, making the blood more sticky, and when you're ill, your blood gets more sticky. Changes to the lining of the blood vessel, and if we think about something like COVID, it causes problems in the lining of the blood vessel. And the last one is poor flow. And we know that the veins are really dependent on the muscles around them squeezing the blood upwards and onwards. Particularly true in the legs. You need to move around, and the leg muscles will squeeze the blood on. So if you're immobile, it's a major cause of having blood clots. And of course, if you go into hospital, you're not well, you've got the sticky blood, you've got the problems with the lining of the blood vessel quite often, and then you're put into a bed or put on a surgical bed and you're kept very still for a while, you do increase your risk of clots.
So knowing those risk factors, maybe somebody's thinking to themselves, hey, I just had a surgery a month ago, or I was recently in the hospital, and I'm worried that I might now have one of those blood clots, perhaps in my leg. What are the signs or symptoms that people should be looking out for that would tell them, I need to go speak to my doctor about getting evaluated?
Good question. So as a healthcare professional, if I suspected someone had a blood clot, I would be asking them certain questions, trying to find out if they had any risk factors, examining them, and then going ahead, probably doing a blood test called a D-dimer. Now, a D-dimer will look at the blood clotting and see if it's activated, but it's a bit of a difficult test because it gets activated if you sneeze practically, or certainly if you've been in hospital. So if there's any doubt about that, one will just go on to do some imaging. And these days, when we look at legs, we use ultrasound, safe, reliable ultrasound, just a little bit of jelly and a probe, and you can see whether someone's had a clot. And then if someone might have had a pulmonary embolism, a bit more serious, a bit more worrying, we'd go ahead and do something called a CT pulmonary angiogram. So we use CT and we inject a little bit of dye and have a look to see if there's any blockages to the arteries within the lungs. So a well-used test, and again, very reliable.
So now that we know what signs and symptoms to look out for, if somebody's concerned that they might have had a blood clot or they might have one now, what's the typical test that a physician would order in order to figure out if somebody has a deep vein thrombosis or a pulmonary embolism?
So we would, in some settings, do a blood test, and we'd look to see if their clotting was switched on. It's a test known as the D-dimer. But when you've been ill, your D-dimer is high anyway, so it's not a very reliable test. The next thing to do would be to do some imaging. So we would have a look with ultrasound and look at the leg veins. So ultrasound's got no side effects, literally just putting a probe on the leg with a bit of jelly and you can have a look in the veins. If someone's suspected of having a pulmonary embolism, which is obviously more serious, they would organise a special scan called a CT pulmonary angiogram and inject dye and see if there's any evidence of blockage of the arteries.
And I know we're really fortunate now that both that ultrasound of the legs as well as the CT scan are highly reliable tests and are widely available. So it's usually pretty easy to get those. Let's say one of those tests turned positive for a patient. So they have a deep vein thrombosis or they have a pulmonary embolism. What would be the sort of standard routine treatment that somebody would expect to receive? And how might that impact recovery? Like, how long would they take those kind of medicines for?
So we would always give blood thinners. And when I say blood thinners, we've got lots of different forms these days. We've got great choice for patients. We've got injectables, we've got tablets, and we've got different types of tablets. So normally you would start on the blood thinner. The blood thinner won't make the symptoms better straight away, but they stop the clot from growing, which is really important. And then we rely on the body to heal up the clot and to gradually break it down and make holes within it so that the blood can flow well. So we would normally give a blood thinner for 3 months, sometimes a bit longer, in somebody who's had what we call a provoked DVT or provoked pulmonary embolism. When I say provoked, we know what the cause is, in that they've been in hospital and they've been really unwell, and so we would give the blood thinner for 3 months. If they were in the minority and they'd had a blood clot out of the blue, we would call that an unprovoked. We'd look for any other risk factors. Most of those patients these days, we would leave them on long-term blood thinners because we didn't know the cause, and they've got quite a high chance of having another one. So it's safer to leave them on a small dose of blood thinner long-term to prevent further clots.
So as we've talked about, developing a deep vein thrombosis or pulmonary embolism can really be quite a life-altering event. It can be quite serious. Many people may wonder, what can I do to prevent this? Are there strategies I can use to make it less likely to develop a blood clot? What would you recommend?
So I think that we are very aware now of hospital-associated clots. And if you go into hospital, you should usually be risk assessed as part of being admitted to hospital. Your healthcare provider will say, look at you, look at your risk factors, and perhaps put you on small doses of blood thinners to prevent you from having clots, or use stockings, compression stockings, or intermittent pneumatic compression where you've got like rubber balloons around your leg and they squeeze intermittently to improve blood flow. So we've got all those things to reduce the risk by about 50%. For day-to-day life, reducing the risk is all about doing the things that really we all know we should do, and that is being slim. Being overweight is a risk factor for having clots. Good diet, regular exercise, not sitting around for too long, long working hours, playing games for hours on the computer. They're all risk factors because you're immobile for such a long period of time.
You know, you commented earlier about Workhouse triad, sort of those 3 elements that contribute to the risk of blood clots. And one of them that you mentioned was the slowing of blood flow, or what we call venous stasis. And I think you really hit on the importance of getting up and moving and walking, whether you're on a long plane flight or you're watching videos on your computer or working at your desk. Getting up every hour and taking a 2 to 5 minute walk can really make a difference. Is that something you generally recommend to folks?
Absolutely. And I think some of us go in for long periods of working at our desk or playing on the computer. That's absolutely fine. But on the hour, every hour, you need to just get up and wander around the room, kick your legs around, have a little dance, and then get back to it. And also, you can't concentrate for more than an hour, so it improves your work anyway.
I want to change gears for just a minute. You know, we've heard a lot in the news recently about COVID-19 and clots, and in particular, the COVID vaccine and clots. And there's been a lot of concern, and people have asked the question, do these COVID vaccines cause people to get clots? And if so, is this a big risk or a small risk? And even people are saying, well, maybe I should avoid the COVID vaccine so that I don't get a clot. Can you give us just a quick overview of what is the risk of developing clots after the vaccine? And should people be avoiding the vaccine out of fear or not? What's the advice you can offer?
Okay, well, there was an issue with clots and the vaccine, and that was essentially with two of the vaccines, the adenoviral vaccines from AstraZeneca and J&J. And we know from our experience in the UK, we've published a lot and shown that there's a very specific and unusual antibody being generated after the vaccine in a very small number of people. So looking at the world literature, we know that the risk after those particular vaccines is 1 in 50,000 if you're under 40, and it's 1 in 100,000 if you're over 40. So tiny risks, nothing to do with whether you've had blood clots before or if you've got any risk factors. Some really unusual reaction to the vaccine that we still don't quite understand. And these individuals had clots in unusual places quite often in the cerebral venous sinus or in the blood veins within the stomach and the abdomen. And usually not often having a deep vein thrombosis and pulmonary embolism. So that is a rare event that is an immune response to AstraZeneca and J&J, but for the other vaccines, there doesn't appear to be increased risk of clotting. And if I'd had clots before I was on the long-term anticoagulant, I wouldn't hesitate to go and have one of the other vaccines.
So I think that's really important in that there are different types of COVID vaccines. And importantly, some of the commonly used ones, the mRNA vaccines in many parts of the world, have not been associated with these very rare clots. And they should be safe for people, whether or not you've had a history of a blood clot in the past. And so you would recommend somebody who has access to those do go ahead and get vaccinated. Is that a true statement?
Absolutely. And I think the question is bigger than that, because I've looked after COVID patients, you've looked after COVID patients. We all know if you get bad COVID, if you end up in hospital on a ventilator or requiring oxygen, there's a really high rate of clots, much, much higher than we ever thought possible. COVID probably produces the stickiest blood we have ever seen. So we have seen a lot of clots over the last few years related to COVID. Not quite so many now with Omicron and the new variants that we're dealing with now, but it has been a very difficult time. So if your only option is AstraZeneca, the risk of having a clot with AstraZeneca is tiddly compared with the risk of getting a clot with bad COVID.
Yeah, no, that's such an important piece to put it in that broader perspective. You know, for our last question, I'd love to hear from you. We've obviously heard a lot about COVID and thrombosis, and I know that there's a lot of research going on. Thinking about this from a global perspective, are there any major research studies either happening now or that have just recently been released that people would like to know about when it comes to COVID-19 and blood clots and either how we prevent them or how we treat them? What might you share with us?
Well, Jeff, as you remember, when we started out with COVID, we didn't know how to manage these patients. And everyone did the best they could, but now we have a lot of clinical trials showing us very clearly what doses of blood thinners to use in the patients when they're in hospital. So we've got good prevention in hospitals. We're also very aware that COVID can, when it presents, look like you're having a clot, but actually it's COVID having a very odd effect on your blood vessels. So I think everyone's very wise to how to manage the patients in hospital. The only issues that are left really are if you've had very bad COVID and you've been really unwell in hospital and you're finally going home, should you go home on a blood thinner? And the trials are answering those questions at the moment.
Yeah, it's really been an interesting and exciting time for research, as we are now learning so much more about how to care for, how to prevent, and how to treat these clotting events when they do happen with COVID. So I agree. We're in a better place than we were 2 years ago, and hopefully we'll continue to learn more so we can best treat our patients. Well, I want to thank you so much, Professor Hunt. Your expertise and guidance today has been really wonderful. We would like to let all of our viewers know that the World Thrombosis Day campaign offers a variety of free resources that are available to download, and they'll accompany this video. So we encourage you to go ahead and view them. For more information on blood clots, including some of the resources I just mentioned, please visit the World Thrombosis Day website at www.worldthrombosisday.org. Thank you so much for joining us today.
Thank you, Jeff. Thanks for being such a great host.